Blog Talk Radio.
Welcome to Women Who Rock Investigates, where branding just got even better for women. Our media source provides case studies in the areas of health, policy and government, human resources, and more. Our experts are handpicked with credible information to validate the latest in these studies. Join us each Tuesday at 10 a.m. Central Standard Time after Women Who Rock with Success. Now, let's go to the show.
And good morning, and welcome to Women Who Rock Investigates. And so we thank you so much for tuning in today on our new brand that we have extended for women, where they can still be able to get information, tools, and resources, but on a investigative level of where we go in and we ask professionals questions about things that concern hot topic subjects and buttons. And so today we're going to be talking about the study of oncology. And so today we have Dr. Jain that's in the studio with us today, and she is going to be with us to be able to provide these tools and resources and information to our audience. So good morning and welcome to the show.
Thank you so much for having me. I'm excited to be here.
Great. So let's dive into the interview. And so just tell us a little bit about you before you got started with the medical practice that you're in today. Kind of take us a little bit back before you got started with that, and then kind of guide us through the interest of the reason why you wanted to study medicine.
Absolutely. So I was raised in Kalamazoo, Michigan. I was raised in a family with a father who is a vascular surgeon, and so I was exposed to medicine at a very young age. I grew up very happy rounding with my dad on the weekends. Instead of, watching Sunday morning cartoons, I'd go in and meet his patients. And I just, as a 6-year-old, I thought it was great. It was not so great when I would come home and try to staple my brother's legs shut, because I thought that that's how you fixed an injury, because that's what I saw in the hospital. So it was, I was exposed to it at a very, very young age. And then as I grew, I ended up at the University of Chicago for college, and I really started to understand the science behind some of the biology and the pathophysiology, and started learning a bit of that in my college years, and realized that it wasn't just the patient care that really interested me, it was also the science behind medicine. And so I decided at that point that I wanted to definitely pursue a career in medicine, and I applied for medical school. And I have done most of my training within Chicago, although I did leave for medical school at Michigan State, and my husband and I actually did a 6-month period where we worked in New Zealand as locum tenens physicians. We worked at a small hospital there. So I've had a very exciting path to where I am now, and I really love what I do.
Okay, great. It appears that you do. You started off early trying to put stitches. I guess that's what you were referring to in your brother's. That is so comical. So this was something from a small childhood, that's something that interests you. That is so awesome, because that makes it even more compelling to the patients, where they know that, sometimes individuals have always said, oh, well, you don't know what you're doing. You just got into medical school and you just came out and what have you. So sometimes they feel that individuals may be a little premature in their practice. But when it starts from a childhood status, that makes it even more welcoming for the patient to be able to trust the doctor and the physician. Wow, that is so awesome. So tell us about today. So what is it that you do in the hospital, and tell us a little bit about what oncology actually really means.
Sure. So oncology is the study and the treatment of cancer. So cancer can encompass anything from blood cancers, so things like lymphoma and leukemia, all the way to things like colon cancer, breast cancer, lung cancer. I specifically subspecialize in gastric, GI, gastrointestinal cancer, so things like colon cancer, pancreas, rare tumors like neuroendocrine tumors. I also specialize in GU or urologic cancers, so things like testicular cancer, prostate cancer, bladder cancer, kidney cancer. And I see patients, typically most oncologists see patients in the clinic And then they also see patients when they're admitted to the hospital. And the role of an oncologist is very different depending on the type of cancer that you have. So some patients require treatments such as chemotherapy. Some patients require newer treatments that are available called immunotherapies. Some patients require radiation therapy, and those patients see a radiation oncologist. And there's other patients who require surgery, so of course they would see a surgeon. So as a patient's oncologist, my role is to not only diagnose the cancer, but it's also to help with the treatment plan. And I describe myself as kind of the quarterback for my patients. So what that means is I help coordinate their care. If they need to see a surgeon and a radiation doctor and also receive the chemotherapy or immunotherapy, then I help arrange all of that. And I also prescribe the actual systemic therapy or the chemotherapy and immunotherapy or pills or whatever the treatment might be that they need. So those are the main things that most oncologists do.
Okay, great. And so we're going to talk about colon cancer, since that is one of the medical diagnoses that is kind of trending, I guess, with men and women today. And so I'm pretty sure that the women would love information in regards to that as to what can they do. I'm not going to say prevent it, but what are some of the signs, I guess I would say, as to know, because a lot of times we as women, let me kind of, I guess, break it down. We have corporate jobs. We're mompreneurs, and sometimes individuals do not go in and get their screening. And, of course, I'm going to get one, too, in which we're going to talk about that. They have a new technique, and we're going to just put a pin in it. It's called Cologuard, and so we're going to talk about that, too, so women can be able to get the knowledge and the resources off of that. But when it comes to colon cancer, it seems like it's really developing a little bit more than breast cancer. You hear more and more about it on the doctor show, on Dr. Oz show. You hear a lot about colon cancer. So could you tell the audience some of the signs to, I guess, look for? I'm not for sure if there are any signs. I know you have to go get your screening, but are there any signs that men or women should be looking for in regards to colon cancer?
Absolutely. I'm so glad you brought it up because this is a topic that's near and dear to my heart. So I think the most important thing that people need to remember to do is to get screened for colon cancer. So the best and most effective way to get screened for colon cancer is a colonoscopy. And a colonoscopy, we typically recommend for most people to start at the age of 50. Now, there are new guidelines that are being discussed where some organizations are recommending starting at the age of 45. And if you're an African-American woman or man, we actually do recommend starting at an earlier age than 50 and starting at least by 45. The other thing that's extremely important when it comes to colon cancer prevention, because you mentioned preventing colon cancer, the importance is getting these colonoscopies on schedule, so on time when you're supposed to get it. And the reason for that is oftentimes if you have something that is precancerous, so what that means is, let's say you have a polyp or something that could potentially become into a cancer. Usually those grow relatively slowly. And so if you go for a colonoscopy and your gastroenterologist finds a polyp, they will often either remove or biopsy it, depending on how large it is. Now, if it is a precancerous polyp and they remove it during that colonoscopy, then you have just been the recipient of a wonderful gift, which is the prevention of colon cancer. So it's really important to get these things done because you can actually prevent colon cancer by having these polyps removed before they become a cancer. So that is incredibly important. The other thing, and this is something a lot of people often ignore, is if you have any bleeding, so when you go to the bathroom and you wipe and you notice you have, blood on the toilet paper, sometimes that can be a sign of something like hemorrhoid, but sometimes that can be a sign of something more serious like colon cancer. So if you ever notice that you have any blood on your toilet paper or blood in the toilet bowl after you go to the bathroom, after you have a bowel movement, it's really important that you mention it to your physician. And that's the type of thing that you don't want to wait until your next annual visit. So if you notice that, you don't want to think, well, I'm going to see my doctor in 6 months, I'll mention it to him or her then. It's better to call the office and say, this happened, describe what happened, and then see if they think that you should come in to discuss further testing if it's needed.
Absolutely, absolutely. Because even with colon cancer, as I stated, we want to talk about the colon guard. And the reason why I brought that up, because sometimes individuals, it depends on the physician, and I guess I want to say the training and resources that, and research as well as what the physician has. So take, for example, some physicians, they will offer, you to take the Maalox treatment and all of that, Dulcolax, and then you have to go through all of those other procedures, where the colon guard is something that kind of, I want to say, it maybe bypasses all of that. And so sometimes individuals, they be afraid. I've seen individuals take the colon guard device and they'll just push it aside because they're afraid of it. They don't know what it entails. Even after the doctor has explained it to them, they still become a little fearful. So if you would share with the audience, I don't know if they feel if it's some kind of UFO or something that just flew out, but explain to the audience the effects and the features of it, of how the benefits can be for individuals that use this type of product.
Sure. So Cologuard, it's a stool DNA screening test. So what that means is it detects DNA in your stool when you go to the bathroom. And what it does is it looks for changes in the DNA that could suggest that there might be colon cancer present. So it's really becoming more popular because it's less invasive, obviously, than a colonoscopy and a little bit more convenient for people. So I can talk to you a little bit about how it works, and I'll give you some of the benefits and then some of the concerns about it. So
sure.
The first thing is, like I said, it's a test that identifies this abnormal DNA as well as traces of blood that could be caused by precancerous polyps or by colon cancer itself. So the Cologuard kit needs to be prescribed by your physician, and after you get a prescription, what you'll get is you'll get a kit, and the kit has everything that you need to collect your stool sample. It's got, I believe it has a collection bucket, a bracket, some type of probe, and then a lab tube set, and then some type of preservative solution that will preserve the stool sample when it gets shipped back. And there's also a prepaid shipping label that comes with it. When you use this kind of special bracket and collection bucket that comes with it, you go to the bathroom on the toilet and it goes directly into the collection container. So there's really minimal contact that you have with the sample. Then you use the plastic probe that comes with the kit to swab a sample of the stool or of the bowel movement and place it into that sterilized tube. And you pour the solution over the sample, screw it on, fill out the form, and send it in. So really you have minimal contact with the actual sample. It's actually quite clean and not as overwhelming as it sounds to do. And it's when you tell people they have to do this at home, sometimes they look at you like you're crazy and they say, I don't want to be messing around with that. But it's actually pretty easy to do. And it's also covered by some insurance companies as well if you're eligible for colon cancer screening. And we typically recommend this particular test to people who have an average risk of colon cancer, who are getting tested for screening. The question really is, are you somebody who's at higher risk or not? And people who are at higher risk tend to be people who have a family history of colon cancer, people who've had polyps in the past. So the Cologuard test isn't necessarily right for everyone. After you send in your sample, the Cologuard test, then it's sent back to your physician. The physician will go over the results and then decide if you need any further testing. And so the challenge of the Cologuard test is it shows only a negative or a positive. So the negative tells us that there wasn't any abnormal DNA or blood biomarkers that were detected, which means that it's unlikely that at that time you have any suspicious cancers, precancerous polyps, or colon cancer. If you get a positive test, sometimes that could mean that it's a false positive, meaning it came back positive, but it really doesn't mean that there is a problem. So if you have any sort of positive test, you're going to end up needing a colonoscopy. The nice thing about the Cologuard is obviously it's not invasive. It's something you do at home. But the challenge with the Cologuard is it's not really looking inside your colon. So it's not looking to see if there's actually polyps there. Also, if you eat certain foods before the Cologuard test, like red meat, turnips, horseradish, you can get a false positive test. And because it's relatively new, there's not really any long-term studies or long-term data that will kind of tell us how the screening impacts long-term outlooks if you end up having colon cancer. So it's a really good idea for those who are very, very nervous about getting a colonoscopy and aren't planning on getting any sort of screening and are at average risk. If you're not planning on getting any screening because you're scared of a colonoscopy, I would say then Cologuard might be a good option for you. But I also want everyone to know that a colonoscopy really isn't as scary as it sounds. The idea of it sounds very scary, but to be perfectly honest, the prep part, which is when you're taking the medications to clean out your bowels, so like a laxative basically, that's usually the hardest part to handle. Everything, the procedure itself, most people don't even remember it because you're given medications that kind of put you in a twilight state and give you an amnestic effect, so you won't remember anything. So I still strongly recommend, especially for those patients who are at higher risk, a colonoscopy for screening. But if your physician thinks that you're a good candidate for Cologuard, that could be a good alternative. The other thing to note that if you're going to do Cologuard testing, typically we recommend that for every 3 years. The colonoscopy is typically every 10 years, unless you've been found to have some type of increased risk for cancer. And then we do colonoscopies more regularly.
Wow. That is some great information.
Was very long-winded. Long-winded answer to your question.
No, that is great because that's what the audience is going to be seeking as I stated, because it was something that I think it was something that kind of stood out what you had mentioned, and it was about before you get ready to do the Cologuard, is it may show up a little positive if you eat the red meat, because I know that's what you kind of hear people when you go to networking events and things like that, and then individuals will bring up different things that they may have seen on television or what they have heard on Dr. Oz or something like that in regards to that tough meat that individuals are is maybe difficult to digest, and they feel that is part of the the reason why some individuals may get colon cancer, because it may be difficult to process the meat because it's it takes a while to digest and what have you and things like that, and so individuals are kind of moving away from the steaks and what have you and things to try to avoid even having any sorts of signs of colon cancer.
Right. And then the other thing, that's important to remember, as I mentioned, that colonoscopies are going to be the most accurate because someone's actually going in with a camera and looking in your colon to make sure there's nothing there. So stool sample tests they're not as accurate as colonoscopy. But again, if you're somebody who is at lower risk, I think that it's completely reasonable. And, the other thing that I often educate my patients on is, you were mentioning red meat. So things like processed foods and red meat we have found do increase your risk for certain cancers like colon cancer. So I recommend, especially if you do eat red meat, making sure that you do it in moderation. So, not having a steak every night, not having a hamburger every night, making sure that you moderate how much you eat. And also with processed foods, more and more we're seeing these days younger and younger people presenting with colon cancer. And the question is if part of that reasoning is because of our diet.
Wow, that is something. But, with as you just stated, diet was something simple and wholesome, fruits and vegetables and other, lean meat, would be kind of a great selection to be able to, try out, I guess, but
Yeah.
just like I said, a lot of individuals are concerned about the process of the meat, and then not moving away from the tough, hard steaks and all of that, so they won't be able to run into even trying to think about trying to even get to the colon guard part. And so, and I think that's pretty good, if someone wants to be able to take certain precautions in regards to things that they may need to stay away from. So that's good. So we're going to, on the second half of the segment, we're going to switch from the colonoscopy part to another medical diagnosis that you do cover, and that's going to be with the gastro part. And this is something that I would think that women have a little bit more as well than men, and that's the stomach cancer. I'm not for sure it's the terminology word for it, but the individuals call it stomach cancer. And so we would love for you to share with the audience on some signs of stomach cancer and what we as women can be able to do to prevent or try to minimize this risk of coming towards us.
Yeah, absolutely. So stomach cancer or gastric cancer is definitely something that I treat and something that I see. So the challenge with women, as you mentioned, is as women, we often ignore signs of us not being well, or we brush it off because we have a lot of other things going on. And so because of that, oftentimes things aren't diagnosed until much, much later than they should be. So the things that we look for in that might be early warning signs for something like stomach cancer, feeling full early. So you start eating and you feel like you have this sense of fullness when you haven't really eaten as much as you normally would. If you're getting regular heartburn, so heartburn actually, if you have chronic heartburn, that inflammation can actually put you at risk for something like for certain types of esophageal cancer. So it's really important that if you're having regular heartburn that you need to talk to your physician, because number one, there might be medication. Actually, there are medications that you can utilize to treat the heartburn itself. And more importantly, the heartburn might be a sign of something more serious going on. Some patients who have stomach cancer present with nausea and vomiting. Occasionally, that vomit can have a little bit of blood in it. So if you're ever having any vomiting that also has any blood in it, absolutely call your doctor immediately. If it's significant amounts of blood, I would say go straight to the emergency room. The thing that women often ignore is unexplained weight loss. And this is coming along with any type of cancer. You can have weight loss that you don't understand why it's happening. And it's possible that you think, great, I'm losing weight. I'm back to, whatever my pre-wedding weight or my pre-baby weight. And you're happy that you're losing the weight. But and I've seen it before where women say, oh my gosh, I lost all this weight. It was so wonderful. I didn't think there was anything wrong because, I was losing weight. But if you're all of a sudden starting to lose weight and you haven't made any lifestyle changes or you haven't really started doing anything differently, make sure that you are cognizant of the fact that unexplained weight loss can be a sign of cancer. And then swelling, bloating, stomach pain, any of those types of things could also be indicative of a stomach cancer.
Oh, wow. Yeah. And so that's another hot topic button that's important for women is as I stated, and what you also cover is the colon as well as the gastro. And so if they do lose their appetite, they need to go straight to the doctor. Is that correct?
Yeah, if you start noticing that you're losing your appetite and that when you're eating you're getting full very quickly, those would be two reasons to call your doctor. Now, I also want to point out, because I don't want everyone running to their doctor every week, because I don't want to panic people. So I also tell people, if you let's say you've got a stomach bug, or you're bloated because you're on your period, or you just are feeling uncomfortable. If it's not something significant, so let's say you've got a little bit of bloating and then it goes away the next day and then it doesn't come back, then it likely was something else. But if it's something that's consistently happening every day, give it a few days. and see if it's something that's happening consistently every day, then I would call your doctor. Now, if you are vomiting blood, then you need to call your doctor immediately and go to the emergency room. And when we talk about losing weight, I don't mean 1 or 2 pounds. I mean if you're losing like 5, 10, 15 pounds unintentionally and you're not intending to lose the weight, that would be another reason.
Absolutely. So take, for example, we have all sorts of cancer centers, Treatments of America, and what have you. So how do the patient automatically connect with such as your practice as oncology? Because some individuals, they may just go to their regular doctor, and perhaps maybe that location that they live in may not even have an oncology physician practice that is in their area. Is this something that they have to request, or is this something that they have to be referred out to, or is this? I'm pretty sure it is. It falls up under the insurance as a professional, a physician or what have you. So how would a person that perhaps maybe is diagnosed with a certain cancer that is under your umbrella that you practice, how can they be able to just request services as such? Can they go into their regular doctor and say, look, we don't want to take services from you. We want an oncologist. Do they have that type of privilege?
Absolutely. So, typically patients don't end up seeing an oncologist until they have a diagnosis of cancer. So if you have a diagnosis of cancer and you need to see an oncologist, then the typical steps that happen from there, first, whoever diagnosed the cancer, whether it's your primary care doctor or your gastroenterologist or another type of physician, surgeon, whoever diagnosed it would recommend a oncologist for you to see. It's likely they'll recommend someone that they know, someone they have a working relationship with, which is wonderful. If you're in the community, oftentimes it'll be in a group where multiple physicians work together closely. So that's always nice because you have the communication and you have open dialogue between your physicians, which is extremely important. Oftentimes, if you have a cancer that might be more complicated, or you have a cancer that you might be a candidate for a clinical trial, which I strongly recommend, you might consider going to an academic institution for a second opinion. So an academic institution would be something like a university. So any university hospital should have a oncology department attached. And oftentimes people go to these universities just to get an opinion to make sure that there aren't any newer treatments out there or any clinical trials available that they might be a candidate for. And so I recommend to every patient that they go at least once for a second opinion at an academic institution. That doesn't necessarily mean that you need to be treated there, but at least you're able to get the information on what that particular institution offers. And in doing so, you can then go back to your oncologist feeling confident that you have explored all possible options that will give you the best chance for either a cure for your cancer or for prolonging your life as long as possible. Now, that being said, that's not always feasible for people. Sometimes the nearest university is 2, 3, 4 hours away. So in that case, it's often seeing the oncologist who's closest to you. But again, the oncologists in the community are fantastic and do a great job taking care of their patients as well. So I think that first figuring out who is going to be the most convenient for you, and then if you're able to get a second opinion just to get more information, I always strongly encourage that.
Absolutely. So are there any new research that you're working on in regards to either one of the cancers that we have discussed on today, or are there any workshops or campaigns that you're working on in regards to gastro and as well as the colon cancer?
So there is so much research coming out in oncology on a daily basis. It's just mind-boggling how quickly the science behind cancer is becoming more and more understood. So immunotherapy is something that has been the hot topic in oncology for the last probably decade or so. what immunotherapy is it's a new way to treat cancer where instead of giving drugs that just kind of attack the cancer itself, immunotherapy agents are able to activate the patient's immune system to fight the cancer itself. So what that means is if you are, let's say you're somebody who you get a cold. When you get a cold, your immune system activates, fights off that cold, and then it goes back to sleep because the cold is gone. The virus or the bug or whatever it was that was attacking your body is gone, so the immune system goes back to sleep. What oncologists and researchers have been able to do over the last several decades is find a way to reactivate the immune system. So this ability to reactivate the immune system allows your own body's immunity to fight off the cancer. So there's a lot of research being done with different types of immunotherapy in many different types of cancers, including colon cancer and gastric cancer. So that is very exciting. There have been really huge leaps and bounds made in certain cancers like lung cancer and melanoma and kidney cancer over the last several decades. So we're hoping that we start to see those types of benefits in other cancers as well. There's also drugs like targeted agents where if you have a specific mutation, you're able to target a specific part of the cancer. So there's research coming out on that. And then there's a lot of research coming out right now on something called precision oncology. So precision oncology is where you actually take the tumor itself and look at how the tumor is made up. So look at all the different cells and components that make up the tumor. And when you look at all of those components that make it up, you can actually find ways to attack specific tumors with specific drugs in specific ways. So there's a lot of great research coming out on that. I actually am also involved in research on neuroendocrine tumors, which are very rare tumors, but we have newer ways of treating this particular cancer that have prolonged people's lives much longer than in the past. And then I'm a part of a campaign through the American Cancer Society called the Research Hers campaign, which my other passion is gender equity in healthcare and promoting women and making sure that we have an equitable workspace for all women in healthcare. And so the Research Hers campaign through the American Cancer Society chose me as an ambassador. And what that program does is it focuses on making sure that women's research is funded. So I speak on the topic and I help raise money where the money that we raise goes towards women who are in the science field and who are doing cancer research.
Absolutely. Wow, that is a lot of wealth of knowledge for the audience, for all of us, because I'm going to be listening too. And that's great because individuals, want to be able to know what's the next step, especially if a person has been diagnosed with any type of cancer. The first thing that they're going to be searching for is what is the medical field doing to be able to find a cure, what are they doing to be able to dig into more research about this issue that I have, because sometimes individuals, they never educate themselves. They just go to the doctor, listen to what the doctor says, go home and drown themselves in misery, and they never get an opportunity to know how they can be able to be a support to them, to their own selves with the right tools, resources, and knowledge. Great. And so Dr. Jain, it's just been wonderful with you on today. You have provided beyond what it is that we have been looking for today as women on Women Who Rock Investigates. And so we would love for you to be able to share with the audience as to how they can be able to follow you on any social media platforms that you may have, or how they perhaps maybe can be able to follow you on any digital media sources or anything that you may have that is out. You're welcome to share any books that you have authored so they can be able to study a little bit more about your practice, or if there is something that you have upcoming in your community that you wanted to share in regards to any webinars, you can do that at this time.
Absolutely. Thank you so much for having me on. So I will tell you, you can find me on Twitter. My Twitter handle is at ShikaJainMD, so that's ShikaJainMD. I also have a website where I've written for U.S. News and Scientific American and many other national organizations. So you can find all of my writing on my website, which is www.shikajainmd.com. You can also find me on Instagram, ShikaJainMD. I'm not very creative with my handle. You can also find out more information about the work that I do in gender equity in healthcare. And if you're interested in being involved in the Women in Medicine Summit that I co-founded and I chair, you can go to www.womeninmedicinesummit.org. We're always looking for sponsors and endorsers and really people who are just interested in attending. And that conference is for the empowerment of women in healthcare and closing the gender gap in healthcare. So those are all great ways that you could get in touch with me. And one last piece of advice I'd like to give people, if you're ever diagnosed with cancer or you have a family member who's diagnosed with cancer, I would strongly encourage going to the American Cancer Society's webpage. They have wonderful resources there. And I would urge you against Googling too much because every resource that you read and see is going to be a little bit different. So make sure that you talk to your physician and make sure that the resources that you're looking at are factual and are giving you the correct information because there's a lot of false information out there. So just make sure you're looking at reputable sources when you start doing your own research and your own searching.
Wow. Awesome. So thank you so much for being, once again, our guest on today. And ladies, you can be able to tune in again with us on Women Who Rock with Success Investigates on next Tuesday. And that will be at 10 o'clock a.m. Central Standard Time for all upcoming events. And who's going to be next on our broadcast, you can go to our website at www.womenwhorock.com. Thank you so much, Dr. Jain, for being our guest once again for the third time as our guest on Women Who Rock Investigates. Thank you so much, and have a great day.
Thank you.